Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host Gurdeep Singh Sandhu, homeopathic consultant, and I'm here to deliver your next lecture of Health Education Lecture Series, and we are describing the life, how this life was created, and how this body has started its journey from sperm to ovum, and everything step by step I have described you in this series of lectures, and also uh, up to the full-fledged construction of this body we have described since beginning steps. That's the cell. The beginning step of the formation of this body is this cell, and I have described about the cell and its functioning. Though there are different kinds of cell, different shapes of cell, and different shapes of cell composes the tissues. Different kind of tissues are making this body, and ultimately they have their different functions. In this way, and this whole body has been constructed into different four type of tissues: joint, muscle, nerve, bone, all these things, and all are having their different functions to perform to continue the life. And in this way they are making organs, extremities, and those organs are uniting with each other, their functioning, and the collective function of all the tissues or all the system, because all the tissues are making organs and all the organs are making one system and all the systems are making one life creations. And in this way each and everything inside this body is related to each other with a cooperation of a functioning. So in this way nothing happens without the effect of all the systems are taking part. Means in any function, normal or abnormal, or the systems and functions, organs are taking part more or less. It is understandable that if anything is happening with the circulatory system, and definitely the most important effect will be on the heart or blood vessels. If anything is affecting the kidneys or the urinary systems, definitely it will affect the kidney, ureter, bladder, urethra, whatever. So, whatever the organs are concerned with one system, they are effective, but it does not mean that they are only effective in one system, that they are only localized, means the bad effects or the disease effects or the abnormality of the system is only concerned with the limited system of that one. It's not like that, because the cooperation of all the tissues make cell, make organs, and organ make the system, and system makes this whole body and life. So in this way, any of the tissue is not individual. We cannot say that if something happens, just like there is a boil on our skin, we cannot consider it only the disease of the skin, because this skin is the part of the whole personality: head, mind, head, and heel. So it means whatever happens, it happens with the whole thing. Many times I have described in these programs, suppose if you are at the bank of a pond, and you throw one stone into the water of the pond, you see some circles are making, the water is separating. Water is you can say the with the pressure of this stone, water is going back, going away. That makes the circles of the waters, but it does not mean that it is localized. Yes, our sight, our vision is localized. It has its own affinity, it has its own area that wherever it can see, just like every person has individual length of vision. Some cannot see far distance, some cannot see, even they cannot read even. So there is a different criteria of the visions, and in this way those circles which are making after throwing the stone in the water, they are visible only up to our vision, up to our sight of the eyes. So in this way does not mean that after that those pressure or those expelling the water from, because water is a compact body, there is no gap inside the water. And when you throw a stone, stone makes a gap for himself, stone makes a space for himself in that way, and it pushes the water out. And that pushing of water makes these that we can see the circles of water, circles of waters, all these things we are seeing over there. So those circles are not limited on to only to the localized water. These circles are to all over the personality, all over the body of the pond. It depends how much our vision is can see far away. But now there are devices. There are devices that with the devices we can see these things happening, and these things you can say throwing the water away, pushing the water away from that point where the stone was thrown. From that very point, it goes to the bank of the pond. It depends upon the sensitivity of the receivable sensitivity of the and that device, that it can absorb. It can absorb those things, those pressure, those throwing out the water away from the stone lines. We can assume at the bank, even it may be in miles, it may be in, just like the telephone linings working in the sky, there is no gap in this way. And ultimately we ring here and we can listen in India. The same way this thing happens, and same way is our body constructed. That is why our Gurbani says, jo brahmande soi pinde. Whatever we observe from the this universe, the same thing is happening inside our body. Means there is no gap inside the body. There is no gap in the functioning. There is no gap in between the organs. There is no gap. So everything is collectively working and collectively united with each other, so that a life is created. So in this way, any individual site, if it is representing any abnormal signs, disease signs, just like I told you about the boil of on the skin in anywhere, and we consider no, it is concerned only with the localized area. The boil is only hand, only on the feet, only on the backs, and we try to correct it from that very points by local applications, but it is not. We should must assume this idea that it is a collective effect of this universe of our body, universe of our life inside the body, you can say, that it is pushing something out from a particular type of source where we can see it in the shape of a boil. Otherwise, it has spread out, it has separated the waves out throughout the personality, mind, and physical body from head to heel. From every organ, it has passed more or less. It has shown its effect in all the systems. It is our preservations, it is our senses, it is our machinery that how far we can see it. That suppose if there be any problem in the heart, and we can see it in the kidneys. If there is any problem in the kidneys, then we can see it in the hearts or functioning of the hearts. same way in the liver, same way. But it is, some of the organs are directly affected with that one, and we see these effects uh, directly in that channelized system. Channelized system means just like the digestive system starts from mouth, ends at the anus. So it runs in a channel. But their effects ultimately affects the whole system, all the systems functioning inside the body. Because body and a life is a single unit, just like the universe. It's a single unit. And that single unit may have composed of, just like our body is composed of nine systems. So nine systems are a unique body. Nine systems functioning visibly, it looks like they are having different functions, but collective effect of their functioning is unique. If heart is not functioning, definitely it will affect the kidney. If kidney is not affecting, it will definitely affect the hearts. And it does not mean that it is not affecting the other organs. Means it is affecting the other organs as well. So this must be considered for the purpose of the treatments. And in my today's lecture, I want to convey this one, that now it has become a trend in the medical science that we are analyzing, we are identifying the disease symptoms mostly in the local area, in the local system, in the local part of the body. And we are not considering that it has any relation with the other systems of the body or other areas of the body. But it has. This is what I want to prove you, that even in small boil on your finger has a relation to your heart, has a relation to your kidney, has a relation to your other systems of the body. But yes, and one another example I can give you. Suppose if there is a death of a nearest and a dearest in your family or in your relatives, we are sad, we are grieved. And this grievedness and this sorrowness, this sadness is relatively percentageable, percentageable, that how much we are closer to the dead persons, that makes the 100% closer persons. And then how far we are, that's the distant persons. Yes, distant relatives may have less sorrow, less grieved, less pain for the dying of a person. But it does not mean that they do not have. They may or may not realize. Wherever the senses are, wherever the senses of the body are concerned, that's the nervous system, that's the brain, they accumulate the effects of every action, every function inside the body, anywhere. Anything happening to the fingers, anything happening to the feet, it sends the wave, it sends the information, it sends that sorrow or grieved to the centralization of the body. But at a distance, we do not see much effect of that one, but we cannot ignore that there is a effect. Just like there is a some turmoil or something like happening in one state of the country, and that is that looks like that's a localized, but it cannot be assumed that the total machinery of the country is okay. They feel it, they realize it. Okay, as far as of the sensitivity, now our sensitivity is the media. Our sensitivity is the media. Suppose if that news is not spreading, there was just like an 84, you can say this blue star action, you all of you know that. But if you go to south, they do not know much about that blue star, what was happening, everything. They just have a simple news about that. But sensitivity of the media, the sensitivity of the relations at a distance, they are also decreased. But it is not that as a whole in the totality of the country, that it is not affecting to those persons. Not much. But at a local area, we feel it much. Just like growth of the country. The growth of country does not depend upon one state or two or three, four states. It depends up totally as an average the growth of the total all the states of the country, and that makes as an average the growth of the country. The same way this body functioning, suppose there are 9 systems. Out of 9 systems, 8 systems are working normally. We see normally means that they are carrying on their normal function, whatever supposed to they should do it, they're doing it. But one organ or one system inside the body is not working normally. Does not mean that the GDP, growth, development, normalcy of this body will be counted as 100. No, it will not be. And the effect of this thing is accumulated. Results are accumulated, and ultimately it makes the percentage. It means it means anything happening in one state, anything happening in one system of the body, anything happens in one site of the body is affecting the whole GDP of our body. And the normal life is 100% GDP. Growth points, growth of the country is not depending only on one state. It is collective effect and collective results of that one, that how much is the growth, development of this country. Same way in this body, if any of the organ, if any part of the body is showing something which is not normal, it means affecting the function of there. It is affecting the function of that local area, and that function in the local area is not produced by only because of the local area. It has accumulated effect, sensitivity effect, and which is affecting or changing the GDP of this body, the normalcy of the life in whole body, in all these systems. So that is why I just want to convey to you that anything happening anywhere in the system, anywhere in the body parts, is not only the localized thing, and that we should cure it, we should cut it, just like nowadays the surgery, the trend of surgery is, if there is an organ and we cut it, and ultimately we are ignoring the percentage 100% GDP of this body. Functioning of this body will not be 100%, because nature has made and given has the percentage to all the systems working inside the body. And if any of the organ is not working in any of the system, it means it cannot produce its 100%. Though function wise country is still running, though function wise this body is still working, if there's no arm, no hand, one time there's no leg, but even then life is going on. But it does not mean that it is not affecting the total GDP of this city, of this body. It is. It is somehow it is affecting that one. The same thing is the disease conditions. When anything happens as a disease in any of the part of the body, in any system of the body, it is affecting, it has its effect on all the other systems of the body, more or less. They are affecting all the systems. Just like another example, I can give it to you. That's just like simple thing which you understand: digestive system, indigestion, constipation, gas formation. These are the normal things that you can understand. That if there is any problem, does not mean that this gas problem is only affecting the digestive system, though most of the symptoms are produced by the digestive system. Most of the symptoms are produced by the digestive system, and our target becomes the digestive system. Whereas it is not, as a whole, it is not only the digestive system. You will not be able to work fully 100%. It will attract your attention. It will hurt your ability to work. All same thing with any lung problem. Does not mean that it is localized to the lungs. It is affecting to the whole functioning of the body. Same way the heart. We cannot say that, oh, this system, we can ignore that. We cannot ignore that. We cannot ignore any systems functions for the normal GDP of the normal life, uh, going through this body. It means all collective effect of all these systems makes a normal 100% GDP. And if a part of the body, organ of the body, system of the body becomes sick, it is affecting the GDP of the whole life inside the body. Therefore, now come to the point why I have started the discussion. Now, for the cure of this effect, what we consider as a localized effect or the localized disease, will only be corrected if we have collected the effects of all these systems, all the organs, maybe more or less. It is not as the burning, the local area is the burning. It is not that the whatever the complaints are at the local area and the digestive system, and they are having similar effects. Maybe less, but even then, they are affecting because they are attracting your mentality. And when mentality is affected, ultimately this mentality, vitality, has its limit of functioning inside the body. And if it is diverted attention in one side of one organ of the systems, ultimately it is discounting, it is it's not having that much attention to the others. Simple language, it's not having that much attention to the others because vitality is more, attention is toward the sick areas. So what will happen? Other systems will show dysfunctioning, more or less dysfunctioning. They will not be at its normal functioning. Suppose just the same example you can come to the again, that if kidneys are not creating normal urea out of the body, what will happen? It will go to the body again, circulate inside the blood. It will go to each and every organ, and all the organs will be disturbed because this is an extra and toxic substance which was supposed to be liberated from the kidneys, has not been liberated by the kidneys fully. So it will be mixed, and that will go to the other organs as well. and automatically they will not be able to produce 100% of their effect, 100% of their liability. They cannot discharge that. And ultimately, if we are going to cure that one, to whom should we contact? We should contact the higher authority. That's our vitality. What the vitality feels, what he realizes, though major effects, when the vitality will explain this body is sick, vitality will explain more important symptoms of the sick area, just like we're talking about the digestive system. And the vitality, first of all, patient comes to the doctor and they say, oh, doctor, I'm having pain abdomen, I'm having gas problem, I'm having vomiting or nausea or diarrhea or whatever it is. So they explain their immediate complaint, present complaint, they complain. But they forget to explain the other things because their attention is just concentrating on the local part. But if you want to correct that one, that you have to follow the directions, because our higher authority, the vitality, knows about that this effect is also affecting the dysfunctioning of other organs, is also causing some depression on the functioning of the other organs, and they are also not able to produce their 100% GDP. In this way, if you correct one local area, correcting means just like the surgery we are talking about, and we go, okay, this local area is there now, cut this hand, cut this organ, body parts, does not mean that we have corrected the case, because every organ, every cell, every tissue inside the body is important for the normal go of life. And if anything is not there, it means the total GDP will be affected. Total the normal functioning of the body as a life will be affected. It will not be normal. So, best thing is to reach to the ultimate is to follow the pain complaints of the higher authority, that is vitality, which expresses himself in terms of symptoms, because we cannot see that. We cannot, air, air is blowing, we cannot see that. The air is, it's out of our sight, we cannot see that. But cold air, we start shivering. Hot air, we feel the heat of the inside the body. Okay, so in this way their effects are realized. Many of the things we cannot see, many of the things we are realizing their effects on our tissues, on our bodies. In this way, the vitality himself is not visible, but it is known by its functioning on the organs, and how the organs are performing. That indicates that how much attention of the vitality has been diverted because of the problem in one organ. So, in this way, if we will listen to the vitality, listen to means it's not visible. How you can listen to it? When I say listening the vitality, means its effect, how it is affecting the organs, how the dysfunction is going on inside the body, because the vitality is affected by something else and having main important disease symptoms in one local areas. And that is not only the one local areas, they are affecting to the whole system. Therefore, always it is recommended. I want to come to this point that to cure the sick person, It is not that you will take the local symptoms of any diseased organs and you will try to suppress that one, and if you are unable to suppress that one, you will cut that organs. It's not that the accurate treatment. It's not that ultimate you can produce 100% of the life GDP. It is not at all. So if you want to prove by your treatment that the life is created 100%, then you have to listen to your vitality, which explains, which cries, and that cry is known by the symptoms, symptomatology, and those cries, the symptomatology is the mental symptoms, mentally, what we feel. Just like I just gave you the examples of the air. Air is blowing, it's cool air, and we are shivering. Our hair shows that, our skin shows that it's very cold. And the same way, s- but under any influence which is able to produce disease, any effect which can cause damages to the function of the vitality and show its effect through any organ or in the whole organs, and to correct that one, the first important thing is the mental symptom. So you can you should collect in each and every patient. If we know that what the mentality is saying, forget that the local disease, forget the local disease, wherever it is, indigestion, whatever it is, any pain anywhere, forget that. What the vitality says about this pain, how he explains himself, that is indicator of vitality's language. That's the indication of the language of the vitality. Oh, I cannot bend down. Oh, I cannot sit straight. I cannot walk. All these things. I cannot eat this thing. I desire this one. I dislike this thing. All these things are the language of the vitality. And nowadays, in homeopathic system of medicines, medicines are produced, means made medicines, because the substances are in the universe. Every medical science is making medicines from the universal substances, and their collective power, their inner power, which the nature has given to, and that substance, just like you can say even sugar. Sugar has given a power by the nature, by the God, you can say, how it affects our body. If we take sugar, if we take sweets, if you take salt, if you take pepper, whatever, how it affects our body, how it affects our mentality. We take a pepper, very irritating peppers, and there is a sweating on our face, and you feel like burning inside the mouth, but there's no fire. You feel like, so every feeling under effect of any disease producing things, influences, is the language of vitality. And nowadays, when forcibly a drug is produced, it is produced by noting the effects that substance, that medicine, that drug to a healthy person, then how he feels after taking sugar, after taking salt, after taking any other things. Our vitality feels just like a cup of tea. You take a cup of tea, you can understand better easily. You take a cup of tea, it stimulates the whole body. It is not affecting only any one area that is going to the digestive system. It affects the whole area and we become active, more active. So this functioning, thinking, everything is changed whenever any substance, even the food you take, that's also a medications. Food, whatever it is made, our masalas and everything, whatever we put in that one, they, when they are given to a person, when a person takes that masala food, whatever it affects our vitality. Though it is going to the digestive canal, but it affects our vitality and how we feel after taking that food, how we express it in words. Yeah, very tasty food. Yeah, it's very spicy food. Yeah, I have some physical symptoms. What some symptoms we will speak out. Yeah, very tasty food. Who says that one? Vitality, the higher things. The tongue has only sent that sensation. These there are sensory buds on our tongue, and that this after taking any food inside, they send the sensations to the brain and the vitality, and the vitality feels, oh, it's very tasty food. Oh, it's very spicy or it's very salty. Whatever, the tongue sends the sensation to the higher authority and it feels that. In this way, in this way, any substance which is used as a medicine was proved in its natural form by giving it to a healthy person, how it affects. How it affects to that one. What he realizes after taking this one. And whatever he realizes this thing are the mental symptoms, are the expression of our vital force. After taking this one, how the vitality feels about that one, that is expressed in the mental symptoms, the feelings, our desire and feelings. These are the expression of our vital force. And if we listen that thing, and if we produce medications according to that sensation and feelings of the vitality, and under any influence, under any type of feeling which is a sick feeling, and you want to remove that one, you select medications which can produce similar type of effects. And ultimately, what will happen? The minor effect which was produced by really spicy food will be abolished by your stronger effect of the medications and the regular effect. Suppose you have taken a pepper. You have taken pepper one time, you feel burning on your tongue. Ah, it's very burning. But now it has caused effect on your vitality. And that's why you say, it's burning, yeah. It's very burning type of thing, sensation like that. It may be in the skin, it may be in the mouth, and maybe anywhere. We have to just find out those type of sensations, and then we have already proved the medicine there. Now there is a big number of medications we have proved by giving substances to the healthy persons, and proved it that yes, they can produce this kind of symptoms. And any medication which is capable of producing this type of sensation, when it was given to any healthy persons, we know that this is the quality and this is the power of this substance, and we give that medications to the patient. And ultimately, what will happen? There is a nature's law. Every weaker dynamic effect is extinguished by the stronger dynamic effect when both are different in kinds, similar in their effects. Means similar in their effects, how they can affect the human body. Now the pepper was affecting the human body, that it feels burning type sensation in the tongue. And now we have other medications which can produce similar type of effects, and we give that one to the patients. It looks foolishness because he's already having this burning effect, and you are giving the same medications to him. But no, there is another law of the nature that every effect has a counter effect. Primary effect has a secondary effect, which is totally opposite to that one. And in this way, we have overpower the natural effect. We have overpower the natural effect. But now the control is in our hand. Now that pepper effect has gone. Burning was produced by the pepper, and we give some medications which can produce the same thing, but in little bit stronger. And as the dose of the medicine is in our hand, we can continue that. We can increasing the extent of that one. That's the potentization. Ultimately, that effect, the natural effect of the pepper, will be removed. Will be removed. And now we know that that whatever the effects are, these are because of our medications. Then we withdraw that one, and ultimately the body becomes free of the disease in the secondary effect. But suppose I'm saying another thing, because everybody can doubt about this thing. Yeah, so if you take pepper, ultimately there is a burning thing, and one person will bring the and just like milk, a cup of milk, you take one, you feel better. This is what one example I'm giving to you, and you feel better after that, after taking a cup of, or even putting some ice on the mouth temporarily. But when the effect of that milk and everything will go off, because it's a disease, I'm just giving the example of the pepper, but it's a disease, and disease has a different source. Disease has a different causative effect, and we do not know. But that has produced a burning type of sensation in the mouth. Temporarily, you can relieve that. And even the paper effect, it's a temporary. It will be for only some few minutes, and after that himself it will go, because nature itself produces some saliva inside the mouth, and that is washed out. But I'm talking about the disease. Because of any disease, you feel burning type of sensation, just like pepper. And mouth is the simple example, just to tell you. It may burning may be in the skin, burning may be in the abdomen, burning may be in the leg, in any muscle. This can happen. But why it is, we do not know that. Here, milk will not act. If there's a burning in thigh muscles, you feel a burning. It's not that you will put milk on that one and it will relieve that one. Or if you put ice on that one, it will relieve that one. It will be just a temporary effect. And when you will take it off, ultimately you will start feeling again, because you do not know the source. Where is the source of that thing? Unless that is relieved, this will not go. And the source, it's not that we have taken the pepper and we are having a burning inside the stomachs, and just to put milk in that one, and temporarily you will be relieved. But if this is the acidity produced inside because of some reason, because of some disease, then at one point you can blame that vegetable was very spicy, that's why I'm having a burning and this and that. That burning will be relieved temporarily, because the body itself try to recover that one. But just think, this burning is produced because the internally, because of some damage, acid is produced regularly, and it is causing continuous burning. Everybody, most of the people are having acidity, burning, all that one. And temporarily they relieve it by taking milk. They temporarily they are relieving by taking any antacid or whatever it is. But it's not going forever. Why? It is not going forever because the source of production of this symptom, this abnormality, is somewhere else. Causes are somewhere else. And all those causes we do not know. Only our vitality knows, and that expresses. If you ask anybody, what's your complaint? Yeah, why you are sad? Why you are crying? Why you are weeping? He will tell you. So the cry, the control of this body is in the vitality. And vitality feels why there is acidity in the stomach, why there is a pain in the knee, why there is a anything happening to my arm or leg or anywhere else. Why it is happening? Vitality knows. We do not know. We have to listen in spite of doing X-ray, doing lab test, this and that. They show how far the disease has progressed. All the tests we have generated nowadays is not the treatment. They just show us that at presently what is the condition of the organs inside with the effect of that disease. But where is the disease and how the vitality is feeling? If we take up the feelings of that vitality in terms of symptoms and we treat those type of feelings by the medicine, just I told you that we have proved the medicines, and when we give any substance to a person's, he produced mental symptoms, he produced physical symptoms, and all that we collected. These are known as the key points, key symptoms of a medicines. And then we, on the basis of that, those key points, we find out that what the vitality is saying, it means this is the main indication that we can reach to the source of producing that acid inside the body. No way other. This is the only way. Listen to the vitality and try to combat that, try to eradicate that by the symptoms, by the medications, which can produce a similar type of symptoms. Then you will be able to cure this one because it's a central point. You do not know that. Vitality is expressing himself. And when the vitality is expressing himself, what type of help vitality knows? People are dying with the starvation. It is happening in south, somewhere in the states, north states. Punjab produces the wheat and food stuffs and all that in quantity, in maximum quantity. Vitality knows that. There is a starvation in Bihar, Bengal, or somewhere else. Vitality knows that the production we can get it from the Punjab and we can spread it over there. But how? How this will be taken out from Punjab? There should be some rule. How it will be taken from that one and transported to the affected states? Same way. Any disease which we feel that it is in somewhere in the body, in someone in the organs. Why? It's why. We do not know about that one. That we have to find it out. And that is only you can say diagnose or understand why these symptoms are. It is only by the language of the vitality. Just like give you the simple example of the acidity. Simple, from any substance you produce burning, that is controlled by the vitality. You one day you take any spicy food, one day you take any spicy food, and when you take any spicy food, at the same day you have burning in the stomach and something like that, uncomfortable feelings that will go off. But suppose if it is not going, then what? Then under those conditions it will remain for a longer period, because we do not know the source. Now we are not taking spicy food. Doctor told me that not to take spicy food if you are having acidity or gas formation, not to take this type of foods, and we are avoiding. But even then there is acidity. Even then, there is a burning in my stomach and gas for me. Why it is? I have taken all precautions for my food, diet, and everything. But even then, I'm having. Then we do not know about that. The vitality knows, and that expresses vitality knows that where is the starvation. People are dying with starvation, and where is the food source? I can get it from there. But when the vitality or the country do not know from where we can take it, ultimately we have to supply it from outside. Suppose there is no food in Punjab, but there is a people are dying starvation in some other states. Then what? We have to supply from outside. Just like our political peoples, they get wheat from outside, rice from outside, whatever they are doing, that's their purpose. I know why they are doing this thing when there is a excess of food materials in Punjab and in other states. Why they are buying it from the other countries? There is some greediness. That's let's forget that. But I'm talking about the disease inside the body, that from where nature itself, just like I gave you the example of the mouth, there's a burning after pepper. You eat pepper, there is a burning, and vitality itself try to control that to produce saliva inside the mouth that dissolve it. You take any hot thing in the mouth and it burns somewhere, and ultimately nature produces excessive saliva to cool that down. That will be done in a short period and you feel okay. But if it is happening because of some other internal reason you do not know, then how you can know? You have to listen the language. Whosoever is suffering, who is suffering? Vitality is suffering. Body parts are under control of vitality. Body functions are under control of vitality. Then we should listen the language of vitality. Vitality knows about that one. What the causes of my acidity? What's the causes of my burning? And what is the source of that one? Then it will cry up and it will tell you what to do. And if you understand better and give help, whatever, suppose if a person is looking for water and you are giving food, it will not serve the purpose. It will not serve the purpose. If he needs water, you have to supply the water. If he needs food, you will supply the food. And if there is a deficiency of sugar, you will supply the sugar. It cries for sugar. It cries for sugar because there is a deficiency of sugar. Some of the people will be astonished when I'm saying crying sugar, because most of the peoples are taking sugar medications. Diabetics, they are taking sugar medication and they are crying, craving for the sugar because unlimited sugar has been burned out by that medications. Ultimately, there is a deficiency of sugar, normal quantity of sugar, and then they send the order to the vitality that we need sugar. And the vitality says, okay, we need the sugar and we crave for sugar. That produces the craving. Why we crave for salty things, why we crave for sweet things, why we take spicy things. This is internal demand expressed by the vital force, with vital power, which is controlling all the functions of the body, is expressing. And we do not see that vital force, but we assume its functioning, we assume its order by the desire. And if we work according to that one, then ultimately we will supply whatever the nature wants to. If a person is having, the taking the sugar medications, and ultimately he cries for sugar. Why? Because more sugar as normal, more than a normal quantity of sugar has been burned by their medications. That is why the body shows the deficiency, though it was there, but it has been burned by the medications and it shows the deficiency. And vitality is showing that one, I crave for sugar. Okay. It means, it doesn't mean that taking sugar is wrong, but side by side, it is necessary that we should reduce those medications, that we should adjust the regularity of those medications, or we should control that medications, or we should stop those medications. And as per the demand, we should fulfill the demand according to the other way. And that way is exercise. You burn out the sugar, you swim, you burn out the sugar. When all the organs are functioning, you burn out the sugars, and then you do not need medications. You need medications because you do not burn out the sugar. And there is a excess preservation of the sugar which is made from your food, preservation inside the cells, and cells are overburdened with the sugar, and they send the situation to the vitality, and vitality expresses it. Weakness, dislike to work, laziness, and all these things are expressed. Watery eye, many other symptoms are there. And then what you do? Oh, we checked the sugar. These are the signs of sugar. Okay, take this medications. It will burn out your sugar. But that medicine which you are taking, suppose if one person is hungry and his demand is only two chapatis, and the other person is hungry, he needs four chapatis. And what's going on in the market, in the medicine markets? They are making medications and they are giving the same dose to every person, every adult person. One adult may be healthy and having about 80 pounds, 100 pounds, 200 pounds. How you can differentiate that one? Yes, nowadays they are doing that. Oh, if the person is this much weight, he should give this, take this medicine this much. If person is weighing this much, he should take this much. But even then, for every person, you cannot do that. Most of the medicines are given. Oh, this is the standard dose of healthy persons. This is the dose of adult person. This is the dose of up to 12 years of persons, and everybody is taking. But whereas the demand of the requirement of every person is different, and one who needs only two chapati, you are giving him four chapatis because it is the dose. He will have an indigestion. But if you are giving two chapatis to the person who needs four chapatis, his hunger will not be satisfied. And this is what going on. Medicines are made in the pharmacies and they are standardized that adult person should take this tablet. And the easy example, before I go, I can give you the easy examples. Birth control pills. Ladies are taking birth control pills, and it has progesterone 125 milligram. It has estrogen at about 0.3 micrograms. Same dose. Every lady is taking that. And some of the ladies are having a heavy bleeding after taking that. Some of the ladies are having no bleeding with this one. Why? So this is what going on with all the medications which are taking, which are going on in the markets. So then how we can combat it? This is what I give you the source. Understand the language of vitality and give help to the vitality. And vitality is invisible. How you can give him the help? How that help can go? How you can mix up the salt into air? Foolishness. But it is mixed up when you smell the ammonia gas. it has smell of ammonia salt, and that salt was mixed into the gas when it was turned into the shape. So you have to turn your medicines in the shape of the vitality and give it to her, because you are asking for this thing. Okay, take this thing. Ultimately, the demand will be fulfilled and the craving will go off, and the limited demand will be created and limited demand will be fulfilled, and the body will become healthy as a whole. When we are healthy, when we are healthy, every person eats whatever is requirement. Every person takes spicy or sweet or whatever according to their demand, and that demand is created by the vitality. What is the demand of the body? But sometimes, in spite of taking two chapati, we take more. Sometimes we have tasty food. Okay, tasty food, we eat more. And next day, that is preserved inside our cells, and we are unable. Suppose you go to the party. You go to the party and you take more sweets, more heavy diets, chicken, goat, this and that, and rasgullas, whatever. And ultimately, when you come from the party and the next day you are unable to go to the job because excess of sugar has been stored in your cells, and there is a less gap for the oxygen to burn it out. And you, oh, yeah, I am tired. I do not want to go to job today because you have gone to the party. In this way, you have to burn it out. Burn it out. This one by exercise, by doing in spite of taking medications. So you can avoid medications. There are other alternatives. This is what I want to convey you. There are other alternatives to fulfill the desired demand of the vitality. And if you understand that one and you have other alternatives at hand in your mind and you apply that one, that demand will be fulfilled. Means you will be healthy in a short way. So today my time is over. This is Gurdeep Singh Sandhu, your homeopathic consultant. And after 3-4 days of vacation, I was gone out, so I could not do that. uh, I joined this one program, and ultimately we will join the regular lecture of function of this body, and we are discussing the abdominal part. We will discuss it, not tomorrow. Tomorrow again, I will be out of my office, out of my studio. Will not be doing the program tomorrow. I will do it on Saturday. So Saturday, Sunday will be continued program about the abdomen. Please listen that one. And if ever you have any question regarding the program, and also regarding the your health, and you are tired of any treatments during sickness, and you are not getting any improvement, you can please call me for your second opinion. 408-687-1899. I will give you answer based on my 52 years of experience in medical practice, so that you can get well soon. And side by side, a request to all of you that if you think that these lectures are giving some knowledge to you and you are improving in your knowledge for the betterment of your life, to go with a normal life, then please convey these messages to the other community members, to other relative and friends, so that they can join me on Facebook. They can join me on Sabrang radio station, sabrangstation.com, www.sabrangstation.com. You can go to that one, and then you can join me, and every day from 5 to 6 p.m. California Pacific time, and you can listen these lectures every day. And also there is a YouTube channel for me, Homeo Medicine, lectures by Dr. Gurdeep Singh, that you can join in YouTube. And also you can listen even later times, any times when you are free, even when you are traveling, you are going in a car, even then you can listen all these lectures. If you have tune in your phone, iPhones, then you can listen these programs anywhere in the world, when you are traveling, when you are sitting in whatever position. So join that YouTube channels, Homeopathic Natural Medicine by Dr. Gurdeep Singh. And also the Facebook, as I told you, you can call me, you can join me at my Facebook as a friend. And whenever there is a lecture every day from 5 to 6 p.m. California time, you can listen these lectures. Rabaraka, God bless you all. We'll see you Saturday, not Friday. Tomorrow is Friday, and I'm going somewhere out again. So I will see you. Sorry for that one, but I will see you on Saturday. Thank you.